Hello, my name is Angel. I'll be your nursing student for today. How are you today? Perform hand hygiene. Verify my patient's name and date of birth with the wristband. Okay, ask the patient if they're allergic to anything and provide patient privacy. So now I'm going to go ahead and educate my patient on the procedure today, which would be a tracheostomy care as well as suctioning. And this is a sterile procedure, so I'll go ahead and explain that to the patient as well. So I'll make sure my suctioning port is intact, my oxygen supplement is on. I would increase oxygen supplementation for the patient for the suctioning procedure since they need it. And I will now begin with the sterile technique. So I use my sodium chloride solution with my sterile technique here for the suctioning. I would open away the tray. Make sure I get my surgical gloves. And open away. Make sure I put my glove. Okay, so now that my gloves are intact, I will go ahead and break sterility by uncapping my solution. I'll be doing this with my non-dominant hand, and I will get my catheter from the tray, and I would pour the solution onto the tray just in case I would need to flush or clean my catheter. So now I will go ahead and grab the suction, usually near the patient's bedside, that's attached to the wall. I would connect the port from the catheter and my suction port next to me. I will go ahead and connect them. I would use my non-dominant hand to intermittently close and open the suction while it's on. And now I'm just gonna go ahead and roll my catheter onto my arm so I can go ahead and remove the oxygen thing here, oxygen mask. And then I would go ahead and insert my catheter into the cannula. And now during an intermittent process, I would just click in and out while I rotate my wrist as I go outwards from the cannula and make sure I don't touch anything on the outside to break sterilization. And when I insert it, I'll make sure I keep putting it down until I feel resistance or the patient starts coughing. So I'll go ahead and do so now. Okay, so I would just, patient coughs, that's fine. So now I'm just gonna go ahead and start suctioning. This should be a 10 to 15-second procedure. So I'll go ahead and just press the suctioning in and out like that. So just rotate it out. That. Okay, and I'll remain suctioning so all the secretions can fully go into the suction port. I would go ahead and now also place the oxygen mask back onto the patient. Usually if I had to, I would do this about 3 times if needed, depending on the type of secretions, if they're thick or not. And then that would also, and then if I do need to clean my catheter, I would also suction some of the solution onto it as well. Once the suctioning is done, I will ask the patient if they felt any discomfort during the procedure, and if not, I can go ahead and unattach my port, turn off the suction, and remove my materials and discard and dispose of them, and I can document the type of findings and milliliters I received from the fluid secretion. Okay, so now we're gonna proceed with the tracheostomy care. I'm still with the patient at this point. So I would advise them that I will be replacing their fenestrated drape, and I will be cleaning the track site using a sterile technique. So here I have my tracheostomy care kit. I'm first gonna uncap my my saline solution. Okay, I'm gonna open my kit away from me first. It's not break sterility. Okay, first have my first drape, so I will put the shiny side down, hold them within the 1 inch margin or border. Okay, so now I can go ahead and put on, well, I can go and put on my sterile gloves as well. Okay, now once my sterile gloves are intact, I will choose my non-dominant hand to break sterilization in order to remove the mask, the oxygen mask. And I have my tools here. This here will be my track toothbrush. These pipe cleaners, thank you. As well as my cotton swabs. And then I also have these sponges. And a fenestrated dressing as well. And my ties. Okay. So now with my non-sterile hand, I will go ahead and pour the solution into each compartment. Okay, and once I do that, I will go ahead and remove the cannula from the patient's track site. I can only hold the flange with my non-sterile hand, so I will go ahead now and dip this into the first compartment with the solution. Make sure it's wet. Use my tube cleaner. Go inside and clean it, as well as the outside. Then I will go ahead and pour it into my second compartment, and then tap till it's dry. And then I can go ahead and place the inner cannula back into the patient. Okay, and I can put their mask back on so they can receive oxygen. And now I can break sterility and just clean the site of the trachea for the patient. So I will go ahead and dip one of my sponges into the third compartment that wasn't used with the solution. Come to the patient, remove their mask, lift up their track site just a little bit. And well, first I'm gonna remove the fenestrated dressing they have on. And now I can use my sponge to clean the site. Use the second one to clean the outer cannula. It's also good to clean the respiration mask as well. Okay. And my cotton swabs to clean the actual site. So I'll dip them into the solution. And then the fourth one. Okay, once the trachea site is clean, I will go ahead and dry it with the remaining swabs with the remaining sponges I have. Verify with the patient if there's any discomfort during the procedure. Make sure it's clean and dry. And now I'll go ahead and apply the new fenestrated dressing from bottom to the top. Once the new fenestrated dressing is intact, I will go ahead and use these ties or Velcro if available. I will leave the old remaining ties there until I apply the new ones. And I will make sure that this tie is able to loosen up if anything. Okay, I will go around the patient's head, so I'll ask them to lift their heads if there's no trouble to them. And I will put the tie on the other side as well. Make sure the track side is not loose, and I can go and loosen up the older ties on the patient. Thank God they had a photo pro. Okay, and once I do that, I can go ahead and provide the patient back with their oxygen and dispose of my materials. And I will ask the patient if there's any distress that they felt as well during the procedure. If not, I will educate them again on track care and cleaning their site and risk of infections, and lower the bed to comfort level, as well as the rails, and leave call light in reach.